Hi everybody, it's your bipolar buddy Ren, and I want to wish everyone a happy Pride Month and talk a little bit about queerness as an umbrella term. I'm not saying everyone has to identify using that label, but just to include everyone. Queerness during Pride Month and mental health concerns that can go along with that. So I learned some of this from one of my professors in my PhD program who did research about queerness in youth and how that related to their mental health and academic performance and so on and so forth. It can be really hard being open about who you are when you belong to the community. And it can be really scary sometimes, especially if you live in a very conservative area. It's hard to feel comfortable being out and proud of who you are and comfortable in your own skin. And some things that folks in the queer community are prone to, just as a lot of people are depression, self-harm ideation or actual self-harm, and suicide ideation or actually committing the act. And I think it's important to be aware that these things happen because it can be so isolating and there can be so much fear involved about being who you are. Just being yourself can be a very scary thing, depending on where you live, the people around you. Do you hear a lot of hate speech, a lot of prejudice, stereotypes, misgendering, so on and so forth? So if you are an ally, friend, family member, whatever, be on the lookout for some signs that your friend might not be okay. And that can include isolation, that they say they're feeling very lonely. They suddenly kind of drop off the face of the earth and aren't communicating as much. You can also look out for things like, do they seem fixated on death? One thing a lot of people don't know is that when someone has come to the decision that they are going to end their life, they often become very, very happy very, very suddenly. So nobody expects it, right? But when you have a plan, sometimes it does feel liberating and exciting because you know that things will be over soon. The pain is going to stop. So be supportive. Check in. Make sure that they're doing okay. Spend some time with them. Give them a phone call. Do the best that you can to just be a supportive ally. And thank you so much, all of you, for taking the time to watch. And again, happy Pride. Bye-bye. I'll talk to y'all again soon.